Testing for cancer. Cancer is a really diverse disease. It's characterized by really abnormal cell growth and the ability to invade or spread other parts of the body. The cancer rate is obviously increasing, and one needs to therefore improve the ability to detect and treat the cancer rather early. Circulating tumor cells are actually cancer cells that have broken away from the primary tumor, and they enter the bloodstream where they circulate and have the potential to produce metastatic diseases. So the goal is really to discover and analyze and screen the cancer cells in every step of the disease. One can identify through a circulating tumor cell. For example, an OncoStat test will identify not only the chemosensitivity testing involving the patient's individual cancer cells in the lab to see which drugs actually demonstrate, drugs or even natural therapeutic agents can demonstrate the best response. So it actually provides guidance as to which treatments and prioritizing them, which would be best for the patient in a clinical practice. So the OncoStat Plus would be the first go-to in terms of identifying circulating tumor cells and immunophenotype it for the particular cancer. And it'll also give you an indication as to whether radiotherapy or hyperthermia would be ideal for that particular patient. Then you also then have the capacity to identify and prioritize the chemotherapeutic as well as natural substances that might be useful for this particular patient. Now, the general cancer assessments are your CA markers, and that is done through the standard Medicare system. However, one can also identify nagalase, which is really stands for N-acetylgalactosaminidase, which is nagalase. The identification of nagalase in the blood is correlates directly with tumor burden, basically suggesting the presence of cancerous lesions below levels that are detectable by other diagnostic means. So nagalase is a really sensitive test for therapy indication or monitoring the efficacy of therapy in cancer and in certain viral conditions as well, such as HIV as well as autism. Now, BRCA tests are fairly popular and they are available for your breast screening and ovarian cancer pictures. In addition to the OncoStat Plus, we also have the capacity to identify the genomic assessments, detoxification genomic assessments to determine pharmacokinetic aspects of onconomics chemosensitivity assays. So you can actually identify the gene polymorphisms that are associated with that level of chemotherapy, as well as the alpha CGH arrays. These arrays are genomic hybridization arrays. They identify with really great, highly sensitive aberrations to assist identifying the primary origins. Where does that tumor originate from? And then there are also prime assays that can identify your capacity for additional therapies like dendritic cell therapy or SOT therapy. These are the various therapies that are available for cancer patients. So to determine which test is right for you, please speak to your healthcare professional. Check out the Learning Center to learn a little bit more about an in-depth education on this topic, but definitely contact us if you wish to order a test, interpret your results, or seek guidance on your health condition. Thank you.